Hello, everyone, and welcome to our question lab. This evening's topic is hematology and oncology. And leading our discussion today, once again, is Dr. Paras Vakaria. Dr. Vakaria, you want to introduce yourself?
Great, thank you, Sean. Yep. Hey guys, I'm Paras. I'm a dermatology resident at UT Southwestern here in Dallas, Texas. I originally completed pharmacy school in Missouri and then went back home to Michigan to do medical school. And now doing dermatology. I've worked with USMLE-Rx as an RX coach, working one-on-one with students to help them prepare for step 1 and step 2 CK as well. And I'm happy to lead tonight's session as well. Thank you guys.
Excellent, we're happy to have you here. We also have some panelists with us, Kate and Jeff, who you'll meet later. Another one of our RX coaches serving as a panelist tonight, Mark Hesslin. Mark, do you want to introduce yourself?
Hey everyone, my name is Mark. I'm a fourth-year med student at Cooper Med School in Camden, New Jersey. I've been working with RX for about a year now, helping students with step 1 and step 2 CK. And I'm currently applying to internal medicine residency for next year. I'm happy to answer any of your guys' questions.
Excellent. If you look at the GoToWebinar control panel, you will see a question box, and you're welcome to type your questions in there, and Mark, Kate, and Jeff will do their best to try to answer all of them. My name is Sean. I've been with Scholar RX and RX Coach for a little over 2 years now, working primarily with RX Coach and our coaches and students to help them accomplish their goals through coaching and tutoring sessions. And we'll talk more about RX Coach a little bit later this evening. But as we get started this evening, one thing you should keep in mind is that the methodology we use throughout this evening will be the same methodology that we use in RX Coach. And the first step of that process is to remove or cover up the answer choices. And the reason we do that is because we do not want your thought process to be dictated or guided by those answer choices. And we definitely don't want you to see an answer choice that you're unfamiliar with, which may cause you to panic as you're trying to get the question right on test day. So I've gone ahead and removed those answer choices for you. After that, we'll go ahead and begin by reading the lead-in. And that is the last sentence of the question itself. And the reason we do that is because we want you to have an organized thought process. We want you to know what the test writer is asking. This way, when you read that vignette, you already know which clues you can pick up on, and hopefully that'll save you from having to reread the question and waste time on test day. So let's go ahead and read the lead-in now. To confirm the diagnosis, the physician tests for the level of which of the following proteins? To confirm the diagnosis, the physician tests for the level of which of the following proteins? After that, we'd like to ask our students how many steps this question will require, and we do that because having that organized thought process makes sure that you don't make any careless mistakes, and it also ensures that you answer the right question without forgetting any relevant steps. So with that in mind, give you some examples. An example of a one-step question could be where you're asked for the diagnosis. An example of a two-step question could be where you're asked for the treatment for a diagnosis. An example of a three-step question could be when you're asked for the mechanism of action for a treatment for a diagnosis. So with those examples in mind, please let us know in the question box how many steps you believe this question will require, and then we'll go ahead and move on to reading the vignette. And it looks like we've got some responses already from some of our veterans, so we'll go ahead and get started with the vignette. Now, in our coaching sessions, the tutor or your coach will stop you after every sentence and ask you what's important, what you want to highlight, what you're thinking. We don't have time to do that today, so I'll read it and try to give you a few seconds after every sentence to gather your thoughts. Here we go. A 43-year-old woman comes to the clinic because of a low-grade fever, fatigue, and confusion. Although these symptoms have been present for a few days, review of systems is otherwise negative, notably for no change in menses or frequency and quality of stool. Her medical history is non-contributory. Today, her temperature is 37.8 Celsius or 100 degrees Fahrenheit, pulse is 89 per minute, and blood pressure is 132/81. On physical examination, the physician notices mild scleral icterus and spots of petechiae on the extremities. Laboratory tests are obtained, and pertinent findings are as follows. Hemoglobin of 9, hematocrit of 27, a leukocyte count of 6,500 times 10 to the 6th, a platelet count of 30,000, creatinine of 2.1, prothrombin time 12 seconds, and partial thromboplastin time 32 seconds. A peripheral blood smear is shown. I'll give all of you a few moments to take a look at that. And here we go. To confirm the diagnosis, the physician tests for the level of which of the following proteins? I want all of you to start thinking about the important clues in this vignette and in the lead-in as I hand it off to Paris. Paris.
Thank you, Sean. So we'll go ahead and show you what we thought were relevant clues in this vignette and lead-in. And so anytime you have demographics, in this case it's a 43-year-old woman, that's going to be the first thing they give you normally, and that's really going to help you narrow your differential of what's going on. This patient has fever, fatigue, and confusion, all important signs and symptoms. Also has, that this has been going on for a few days. We're given some lab findings, some vital signs, as well as some physical exam finds. Those are going to be important, so that's why we highlighted that. And then a lot of lab values, and that's probably what's going to be the most important here in trying to figure out what's going on. Obviously, the image is very important as well, so make sure you're taking a good look at that whenever you have a smear. They're probably giving you that for a reason, so make sure you're looking from top to bottom, left to right, trying to figure out what types of cells you're seeing, any abnormalities. So when we get to the lead-in, what we think is important is what test would you get, the level of what protein would you check to confirm this diagnosis, okay? And so how many steps do we think this question is? Well, I think that's a good question. I think one, we need to figure out exactly what's going on with this patient. Two, given what we think is going on with this patient, what is the pathophysiology maybe? And then how would you confirm that based on the pathophysiology? What's something you could test for? You could also just say that what's the a diagnostic test for this disease. So maybe a two-step question, maybe a three-step question. We'll take a look at the answer choices and see maybe what we're working with. So let's go ahead and take a look at those answer choices. And we have 5 answer choices, and we recommend that students, when they're reviewing answer choices, to start at the bottom and work their way up. So start at answer choice E and work your way up to A. The reason we recommend this is because a lot of times we see students that, start at the top, go to the bottom, they'll see something they like, and then they'll immediately select that, and that may actually be the incorrect answer. Doing it this way ensures that you get through and review all of the answer choices, and so you're not biasing yourself. So let's go ahead and do that now. Answer choice E, metalloprotease. D, kinase. C, cytoskeletal protein. B, clotting factor. And A, bacterial toxin. So make sure you get a good look at that smear and those lab values, and then we're going to go ahead and open up that poll. Select the answer choice that you think is the best answer, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paris. So as always, take a few moments here to select what you believe is the correct answer, and then we will review the correct and incorrect answer choices. Remember that on test day, there is no penalty for guessing, so never leave a question blank. And tonight, of course, all of your responses are completely anonymous, so we want you to take your best guess. We'll wait until about 2/3 of you have responded, and then we'll reveal what the correct answer is. We'll give all of you a few moments here to gather your thoughts and select your answer. All right, well, I see the responses coming in. We'll give all of you a couple more seconds here. Let's go ahead and close that poll and see what you selected. It looks like it was pretty close. 31% of you selected metalloprotease, 26% of you selected clotting factor, and 22% of you selected cytoskeletal protein. So let's see what the correct answer is. And the correct answer is indeed E, metalloprotease, and 31% of you got it right. Great job to all of you, but let's make sure you got it right for the right reason. But if you didn't get it right, don't worry. It's a learning process. Paris is going to explain it to you now so you can get it right on test day. Paris.
Thank you, Sean. Yeah, great job, guys. This was answer choice E, metalloprotease. So let's take a look at the next slide. Sean has actually gone ahead and pulled up a table. So let's take a look at this. And if you joined us last week for our question lab, hopefully this seems familiar to you. So here we have a condition about a thrombotic microangiopathy, okay? Specifically, TTP, or thrombotic thrombocytopenic purpura, okay? Patients present with thrombocytopenia, acute kidney injury, and a microangiopathic hemolytic anemia. So they have anemia, and you're seeing schistocytes on the blood smear. So we'll keep this in mind. Also, on top of that triad, patients also have a fever, and neurologic symptoms, okay? The PT and PTT is normal, which distinguishes this from DIC. And if you look at the pathophysiology, you can see there that it is an inhibition or deficiency of that von Willebrand factor metalloprotease, okay? So going over this presentation, let's take a look back at our question. We can see that this patient has low platelets of 30,000. This patient also has fatigue and confusion, so some neuro issues. The creatinine is 2.1, so we know the patient has renal issues. Temperature is 100, so this patient has a fever. The patient's also anemic, and if you look at that image, you can hopefully see some schistocytes, and that's what was being really the goal of that smear was, is to see those schistocytes. So this is a classic pentad of TTP, and as mentioned, the pathophysiology would be testing for the level of metalloprotease, answer choice E. Let's talk about the other answer choices and why those are incorrect in this question. So answer choice D, kinase. So this could be getting something at pyruvate kinase deficiency. In that you do have hemolytic anemia, but you don't have those other signs and symptoms, neuro issues, renal issues, and so that would be a less correct answer. Answer choice C, cytoskeletal protein deficiency. So that could be something like hereditary spherocytosis. So importantly, you would have an elevated mean corpuscular hemoglobin concentration, and you would not have thrombocytopenia. Patients may have jaundice like this patient, but they may also have splenomegaly, pigmented gallstones, and that's not what we're hearing. And on top of that, you don't have renal crises like in this patient. Answer choice B, clotting factor. So a clotting factor deficiency could be getting at hemophilia A or B. Both are X-linked recessive disorders, so you're more likely to see them at a younger age. And on top of that, the signs and symptoms would be bleeding at venipuncture sites, gingival bleeding, circumcision, bruising and bleeding into the joints. Not what we're seeing here in this patient. And then lastly, answer choice A, bacterial toxin. So Shiga toxin is something that you could be thinking about there, which is something you see in hemolytic uremic syndrome. However, we're not given anything about diarrhea, and we also have additional fever and neuro issues that point more towards TTP than HUS. So in this question, the best answer choice would be TTP, and the pathophysiology would lead to the best answer being E.
Excellent, thank you, Paras. Definitely a challenging question, but great job to all of you who got it right. Those of you who didn't, hopefully you learned from it. You'll get it right on test day. So with that, let's go ahead and move on to our second question. Once again, the answer choices have been removed. That is by design. We always do that as the first step because we don't want your thought process to be dictated by those answer choices. So I've gone ahead and removed those, and we will now begin with the lead-in. Which of the following is the function of the protein most likely mutated in this patient? Which of the following is the function of the protein most likely mutated in this patient? So with that, I'll give all of you a few seconds here to respond in the question box and let us know how many steps you believe this question will require. And then we will read the vignette together. I see some responses coming in. Let's go ahead and read that vignette. A 16-year-old boy with a history of nosebleeds and frequent bruising comes to his pediatrician because he recently began passing blood-stained stool. Physical examination reveals mild gingival bleeding. Laboratory studies show platelets of 250 times 10 to the third, prothrombin time of 13 seconds, partial thromboplastin time of 49 seconds, and bleeding time of 15 minutes. Which of the following is the function of the protein most likely mutated in this patient? Which of the following is the function of the protein most likely mutated in this patient? I want all of you to start thinking about the relevant clues in the vignette and lead-in as I hand it off to Paris.
Thank you, Sean. So we'll go ahead and show you what we think are the important clues in the vignette and the lead-in. So again, demographics. So now we have more of a pediatric case, a 16-year-old boy. They tell us that he has a history of nosebleeds and frequent bruising. Also have blood-tinged stool and gingival bleeding. So a lot of things about bleeding and bruising. This is obviously more of a shorter vignette, so obviously those are going to be very important. They also give us some significant lab studies, and those are going to be important in figuring out what's going on here, okay? So now that we've talked about that, the most important thing in that lead-in is it's asking about the protein that's mutated, but it's not just asking about the protein that's mutated, it's asking about the function of the protein most likely mutated. So it's important to recognize that because sometimes you may miss that and then get the question incorrect. So it's the function of the protein that's most likely mutated. So let's talk about how many steps we think this question is. I would say that one, we need to figure out what's going on in this question, what's the diagnosis? Two, what is the protein that's maybe involved in the pathophys that maybe mutated in the pathophys? And then three, what is the normal function of that protein? So I think probably a nice three-step question here. So let's take a look at the answer choices and see what we're working with. Once again, we are going to start at the bottom and work our way up, and we're going to keep doing that. Repetition is the way to build good habits. So answer choice E, inactivates factors 5 and 8. D, cleaves large von Willebrand factor multimers to proper size. C, acts as a receptor for von Willebrand factor. B, acts as a receptor for fibrinogen. And A, acts as a ligand in platelet adhesion. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the right answer. We'll talk about it in just a few seconds. And for those wondering, in case you can't see that answer choice D, I'll just read that to you. Cleaves large von Willebrand factor multimers to proper size.
Excellent. Thank you, Paris. We'll give all of you a few seconds here to respond. And once about 30% of you have responded, sorry, about 2/3 of you have responded, we will reveal the correct answer choice and review the correct and incorrect answer choices. Once again, answer choice D, for those of you who can't see it, is cleaves large von Willebrand factor multimers to proper size. The word size is cut off. And that's simply because we can't fit it into the text. All right, a few more seconds here. All right, I see the responses coming in. So let's go ahead and take a look and see what the correct answer is. And it looks like 36% of you selected acts as a ligand in platelet adhesion, and 31% of you selected acts as a receptor for von Willebrand factor. So let's take a look and see what the correct answer is. And the correct answer is A, acts as a ligand in platelet adhesion. And 36% of you got it correct, so well done to those of you who did. But as always, let's make sure you got it right for the right reason, something which you should also be doing when you're doing practice questions. And for those of you who didn't, don't worry, we're all here to learn together, and Paris will explain it to you now.
Thank you, Sean. Yes, great job, guys. Definitely a tough question here. So let's talk about this question. So we have a 16-year-old boy with nosebleeds, gingival bleeding, bruising, and blood in the stool. The lab tests show an elevated bleeding time of 15 minutes, and that PTT, partial thromboplastin time, is also just slightly elevated as well. So these are all pointing to some sort of bleeding disorder, okay? This patient doesn't have petechiae, doesn't have purpura, okay? So probably just a pure platelet disorder is less likely. So you could be thinking about hemophilia, you could be thinking about vitamin K deficiency, but not super common. And on top of that, hemophilia does have like a family history. So it's important to think about other causes of bleeding disorders, and specifically mixed platelet and coagulation disorders. And in that case, that could be von Willebrand's disease, okay? So von Willebrand factor is produced by the Weibel-Palade bodies of endothelial cells, and it acts as a ligand in platelet adhesion, okay? I think some of you guys maybe were on to the fact that this was von Willebrand's disease, but weren't able to get to that second and third step. So on the next slide, actually, Sean has gone ahead and pulled up a nice table talking about von Willebrand disease. As you can see there, the bleeding time is elevated. The PTT may be slightly elevated, okay? And von Willebrand factor, it doesn't mention this specifically here, but von Willebrand factor leads to a defect in platelet to, actually it does mention it, defect in platelet to von Willebrand factor adhesion. So the function of von Willebrand factor is helping platelet adhesion. So hopefully you can see now why that would be the more correct answer. Let's take a look at the other answer choices and why those would be incorrect in this question. So answer choice E inactivates factors 5 and 8. This is getting at something like protein C. It activates factors 5 and 8. Patients who are deficient in protein C would actually be hypercoagulable. So that would not be a good choice here. Answer choice D. This is talking about the ADAMTS13 metalloprotease, and that has to do with, if you guys remember from the first question, TTP. And that has fever, neurologic symptoms, renal symptoms as well, low platelets as well, which we don't have. So this is also not the best answer. Answer choice C acts as a receptor for von Willebrand factor. This is getting at something that, you know, where you may have impaired platelet adhesion due to a defect in glycoprotein 1b receptor, okay? And this is the primary von Willebrand factor receptor, and it is involved in Bernard-Soulier disease, okay? So you don't have good platelet adhesion, you don't have good platelet activation and aggregation as a result. You do have a prolonged bleeding time in Bernard-Soulier, but the partial thromboplastin time is normal. On top of that, the platelet count would be low, which is not the case here. Lastly, answer choice B. This is getting at something like Glanzmann's thrombasthenia, which is caused by defects in, again, glycoprotein 2b3a receptor, which binds both von Willebrand factor and fibrinogen. In this disease, you do also have a impaired platelet aggregation and formation, and you do have, as a result, a elevated bleeding time. But again, the PTT is normal, which is not the case in this question. And so this would be pointing more towards von Willebrand's disease, which von Willebrand acts as a ligand in platelet adhesion. So as you can tell here, the pathophysiology of a lot of these hematology diseases is very important for step 1.
Excellent. Thank you, Paris. Great job, everybody. I know we've had a couple of tough questions this evening, but that's okay, because if we do those tough questions now together, you'll be able to get those challenging questions right on test day. And if you want help getting even more questions right on test day and doing well while you're in school or studying for your boards, you should consider RX Coach. RX Coach is our coaching and tutoring initiative. We start you off with a 160 question assessment. We are, I believe, the only tutoring and coaching company to have created our own assessments and question bank. And obviously we have a lot of experience, 30 years in medical education. You know, there's a lot of tutoring companies and coaching companies out there, but you know, I think most of them don't have the breadth of experience that our team has when it comes to medical education, writing resources like first aid or developing USMLE-Rx. So we were able to take all of that experience and data and come up with a coaching program that really takes a progress-based and data-based approach, which is why I think our student satisfaction is as high as it is, as well as, you know, the results that we're seeing are so phenomenal. So we start you off with one of those assessments. We use that as a baseline, and then we help you come up with a personalized study plan. You know, there's a lot of USMLE prep courses out there and review programs out there, but none of them really have an individualized approach. You're doing what everybody else is doing. And on top of that, you also don't have the ability to have somebody guide you through question dissections like we do and pinpoint exactly what your thought process is like, where you're making mistakes, what those knowledge gaps are, what those taking deficiencies are. And by working with you one-on-one and working with a coach like Boris or Mark, we're able to identify your individual strengths and weaknesses, your individual test-taking deficiencies, if you have any, and really help you maximize your potential with our one-on-one approach through these highly trained and RX certified tutors. So if you're interested in reaching that peak potential, if you want a little bit of help, even if you're at a 250, you want to aim for a 260, we've had students do that. If you want help with your medical school exams, if you want help for step 1 or step 2, reach out to us at rx-coach.com. You can click on that free consultation tab, and you and I will have a discussion about the program and how it can benefit you. And if it's the right fit, we'll pair you with one of our wonderful tutors and coaches to help you on your journey. Once again, that's rx-coach.com. You can click on that free consultation tab to set up a chat to discuss the program and how it can benefit you. If you want some general study advice, you can get that also at firstaidteam.com. So with that, let's go ahead and move into our third question of the evening. Once again, the answer choices have been removed, and we will begin with the lead-in. Which of the following is the most likely mechanism for the findings in the blood smear? Which of the following is the most likely mechanism for the findings in the blood smear? I'll give all of you a few moments here to let me know how many steps you believe this question will require. We'll move on to the vignette. All right, so the response is coming in. Let's go ahead and take a look at the vignette. A 69-year-old woman comes to her primary care physician with a 6-month history of increasing fatigue, weakness, and anorexia. Her daughter visited recently and expressed concern that the patient was taking multiple naps throughout the day, which was unusual for her. Physical examination is remarkable for pale, conjunctiva, bilaterally. Her hematocrit is 35%. Her peripheral blood smear is shown in the image, and I'll give all of you a few seconds to take a look at that. Which of the following is the most likely mechanism for the findings in the blood smear? I want you to start thinking about the relevant clues in this vignette as I hand it off to Boris.
Thank you, Sean. So once again, we will go ahead and show you what we think are the important clues in this vignette and the lead-in. And hopefully by doing this in these questions, you can start to see, you know, how kind of what we're thinking and what we are thinking are important clues, maybe what's not important, things like that, okay? So we'll go ahead and show you this question, what we think are the important clues in this vignette and the lead-in. And again, demographics, so 69-year-old woman, okay? They give us some signs and symptoms, okay? Obviously what's important in this question, but also duration. You know, the previous patient, you know, the first patient I think just had a few days history. This patient actually has 6-month history of these symptoms, so time frame is also important. She's taking multiple naps throughout the day. Anytime you have a statement like that where they're giving you something that's, you know, kind of, you know, you're not sure why it's there, it's not really medically related, it probably is related to what's going on. So in this case, I think that's important. We also have some physical exam findings, we have some lab findings, and again, another smear. These smears are always going to be important. So let's take a look also at the lead-in. In this question, this is asking about specifically the findings in the blood smear, okay? Specifically, what are we seeing on the blood smear? But not just that, what's the mechanism for the findings? So it's not just what are the findings, but specifically the mechanism, okay? So that's why we highlighted that, so you don't get tripped up there. So how many steps do we think this question is? Well, I think this could be, you know, maybe a 2-step question. One, you know, what are we seeing in that smear? What are the findings? And then maybe, you know, what are we seeing on the smear? That's one. 2, based on what we're seeing in the smear, maybe what's a diagnosis that we would go with, and then 3, what's a mechanism for that diagnosis? Or it could just be a simple 2-step question as well. So let's take a look at those answer choices and see what we're working with. So answer choice E, once again, we'll start at the bottom and work our way up. Nutritional deficiency of folic acid. D, mutation in the beta globin chain causing destruction of erythrocytes. C, lead poisoning. B, colorectal malignancy. And A, cold agglutinins. So once again, we will go ahead and give you guys a few seconds. Collect your thoughts. We'll go ahead and open up that poll. Select the answer you think is the best answer, and we'll talk about it in just a few seconds.
Excellent. Thank you, Boris. We'll give all of you a few seconds here. Let's try to finish strong with our last 2 questions. Next week's topic will be MSK. We hope all of you can join us once again at 8 p.m. Eastern Time, 7 p.m. Central Time for our question lab on Tuesday on MSK. I see about a quarter of you have responded. We'll wait until about 2/3 of you have. Take a few moments here and select the best answer. If you're not sure what the best answer is, take your best guess, and we'll make sure that Boris explains everything to you so you get it right on test day. If you're sitting there thinking, oh, I should have gotten that question right, or I knew that, why did I get it wrong? Or maybe, oh, I was close, or maybe you had no clue at all. Either one of those situations or any of those situations, if you were a part of that thought process, reach out to us at rx-coach.com. Let us help you and save you some time. Let's take a look and see what you selected. And you selected, 36% of you selected colorectal malignancy, and 33% of you selected nutritional deficiency of folic acid. So let's take a look and see what the correct answer is. And the correct answer is B, colorectal malignancy. And 36% of you got it right. We've got some challenging questions today, but in all fairness, when the topic was Heme-Onc, and I even gave you a brick to look at, which could have helped you with at least the first 2 questions. So let's turn it over to Paris so he can explain it to you.
Thank you, Sean. Great job, guys. This is also another tough question like Sean mentioned. So let's take a look at this vignette again. So this is a 69-year-old woman, okay? That age, really, anytime you have an elderly patient, you always have to be worried about age-appropriate cancer screenings and things like that, okay? So she has fatigue, weakness, and anorexia. Anorexia is never a good sign, and she maybe could have unintentional weight loss. The blood smear, what is that showing us? Well, that's showing us a microcytic hypochromic anemia, okay? A lot of those red blood cells have some nice big central pallor, okay? Those do not look like good red blood cells. There's a lot of central pallor there, okay? And that is indicative of probably iron deficiency in this age, a female patient at this age. It's a microcytic hypochromic anemia, probably iron deficiency. So there are some causes of iron deficiency that we need to know: chronic bleeding, malnutrition, malabsorption, menstrual cycles, increased demand such as pregnancy. When you have an older patient like this, close to 70-year-old patient, you really need to be worried about, do they have a colorectal cancer, or they're having occult blood loss in their stool? And that's part of the reason why elderly patients are recommended to get screening with the colonoscopy to rule that out. So that would be the most likely correct answer and association in this question. But let's talk about some of the other answer choices and why those would not be good choices here. So folic acid deficiency, this would actually produce a megaloblastic anemia, and we would see hypersegmented neutrophils and macrocytic RBCs. The RBCs are not macrocytic here, and that neutrophil is also not what I would consider hypersegmented, okay? So not the best answer here. Answer choice D, this is getting at, either sickle cell or beta thalassemia. These diseases often occur more early in life rather than the age of 69. And on top of that, not really consistent with the patient's clinical picture. On top of that, you may see target cells, which we're not seeing in this smear. So probably not the best answer. Answer choice C, lead poisoning. That could also cause a microcytic hypochromic anemia, okay? However, a blood smear would, in theory, show basophilic stippling, which we are not seeing here, okay? Lastly, answer choice A, cold agglutinins. This is an autoimmune extravascular hemolytic anemia, often associated with an infection like mycoplasma pneumonia. Patients often have painful blue fingers and toes, which we're not seeing here. And on top of that, a blood smear may show like clumps of red blood cells together, which we're not seeing here. So the best answer here is picking up that this is likely a microcytic anemia, likely iron deficiency, and given this patient's demographic information, the thing that we really need to be worried about is a colorectal malignancy.
Excellent, Boris. Thank you so much. So we've got one question left. Let's try to finish strong. And for you veterans who have been attending, this question should look familiar. Once again, we've removed the answer choices and we will begin with the lead-in. Which of the following is the major mechanism of the chemotherapeutic agent that was most likely used to treat this patient's seminoma? I'll give all of you a few seconds here to respond in the question box and let us know how many steps you believe this question will require. And we'll move on to the vignette. All right. The responses have started to roll in, so let's go ahead and read that vignette. A 24-year-old man comes to the physician for a routine physical examination before beginning a new job. The physician notes a small firm nodule on the patient's left testicle, and he is subsequently diagnosed with a testicular seminoma and referred to an oncologist. Soon after beginning high-dose chemotherapy, the patient returns to his primary care physician because of a 1-week history of dry cough and shortness of breath. His temperature is 98.7 Fahrenheit or 37 degrees Celsius, and his pulse is 82. His respiratory rate is 17. A cardiac examination discloses no murmurs or gallops, and both lungs are clear to auscultation without wheezes. There is no dullness to percussion. Imaging results are shown, and you can see that image on the bottom right of your screen. I'll give you a few more seconds to take a look at it. Which of the following is the major mechanism of the chemotherapeutic agent that was most likely used to treat this patient's seminoma? I'll give all of you a few more seconds here to gather your thoughts and identify those relevant clues as I hand it off to Boris.
Thank you, Sean. So last question of the day, we will go ahead and show you again what we think what we thought are the important clues in this vignette and the lead-in. So again, demographics. Now we have kind of a younger male, a 24-year-old male. So we're going to think about that. We also know that there's something going on. A testicular seminoma started on chemo, now having some issues with the respiratory system. Okay, and they gave us some physical exam findings. I think the most important thing here is really in that lead-in. They're asking us about a chemotherapeutic agent that was most likely used to treat the patient's seminoma. But they're also taking it a step further. They're saying, what's the major mechanism of that agent? So how many steps is this question? One, I think we know it's a seminoma. So, we don't really need to know diagnosis, but what was the chemotherapeutic agent that was most likely used? And we're going to have to use a lot of the clues in that vignette. So that's problem number one, figuring out the chemotherapeutic agent. And then two, what is the major mechanism of that agent? So probably a two-step question, but that first step is going to take some detective work. So let's go ahead and take a look at those answer choices and see what we're working with. Answer choice E, stabilization of microtubules against depolymerization. D, inhibition of topoisomerase 2. C, inhibition of microtubule polymerization. B, formation of superoxide or hydroxide radicals. And A, alkylation of DNA. So once again, go ahead and gather your thoughts. Go ahead and open up that poll. Select the answer choice that you think is the right answer, and we'll talk about it in just a few seconds.
All right, so let's try to finish strong here with our last question of the evening. For those of you who attended our oncology question lab, you should recognize this question. We'll give all of you a few more seconds here to respond, and then we will go over the correct and incorrect answers. And of course, we do have a raffle at the end of the session, so make sure you stick around because you must be present to win. Once again, next week's topic is MSK, and we hope to see you here. All right, a few more seconds here, and then we'll see what the correct answer is. All right, let's take a look. And it looks like we have a tie. 32% of you selected alkylation of DNA, and 32% of you selected formation of superoxide or hydroxide radicals. So let's take a look and see what the correct answer is. And the correct answer is B, formation of superoxide or hydroxide radicals. Great job to those of you who got it right. To those of you who didn't, don't worry about it. Boris is going to explain it to you now.
Thank you, Sean. Great job, guys. Also, another tough question. So what's going on here? So we know that this patient now has a dry cough and shortness of breath after starting chemo, okay? They also give us a CT finding, an axial CT finding of the lower chest. And what we're seeing is some cystic degeneration of the back of the lungs, the posterior lung bases. Now, because remember, this patient is kind of lying flat on that machine, so what we're seeing at the bottom of the image is the posterior part of the lungs. We're also seeing some interstitial thickening, aka fibrosis, okay? Pulmonary toxicity and fibrosis are often associated with bleomycin, okay? Bleomycin is a chemo agent used as a first-line treatment for various testicular tumors, including seminomas. Bleomycin has a unique feature of producing superoxide and hydroxyl radicals that cause breaks in the DNA strands. And Sean is actually highlighting that here for bleomycin. And you can see that under clinical use, it actually says testicular cancer. Adverse effects, pulmonary fibrosis. So a lot of the things are in that first aid table. I know it's a lot of detail, but it's all high yield. So let's go back to this vignette, this question, and see maybe what you guys were thinking with the other answer choices. So answer choice E, this is probably getting at taxanes or paclitaxel. Okay, the main side effects there, you don't really have pulmonary side effects, so that wouldn't be the best answer choice. Answer choice D, inhibition of topoisomerase 2, that's getting at something like etoposide. Most common side effects with that would be myelosuppression, GI upset, alopecia, not really respiratory issues, so also incorrect. Answer choice C, this would be getting at something like vincristine, and the main side effects with that and its class of medications are peripheral neuropathies, cellulitis, and things like that, not really pulmonary side effects. Answer choice A, I know a lot of you guys selected this. This could be getting at something like busulfan, which is an alkylating agent that is also associated with pulmonary complications. However, it is not used to treat testicular cancer. So looking back at that lead-in, you can see it was the chemotherapeutic agent most likely used to treat this patient's seminoma. So it was not just which chemo agent has those side effects, it was which chemo agent was most likely used to treat this patient's seminoma. So we had a couple things there, and you can see how easily it is to get confused. So it's important to do this highlighting, and it's important, as Sean mentioned, after each sentence, just to kind of take a little pause and gather your thoughts, try to tie things in together. So great job today, guys, and back to you, Sean.
Excellent. Thank you, Paras. Great job, everyone. Our average tonight was in the 30% for almost every question, right? And, students always say, I don't need a tutor. I don't need a coach. I can get there on my own. And that may very well be true. And we're not saying you can't. What we are saying is you can get there, you can do better, and you can get there faster if you use a coach. You know, if you study for months and months and months, there is an opportunity cost associated with how long it takes you to study for STEP. And our students always tell us that when we used a coach, our studying became more efficient, we saw more rapid gains, and we got to where we wanted to be in a more timely manner. So if you're interested in an RX coach, please go to rx-coach.com and schedule that free consultation. For those of you who want to look into these questions on your own time, feel free to take a screenshot or write down these question IDs. You can simply type these into the RX search field if you have access to our QMax question bank, and review these questions on your own time. I'll give you all a few more seconds here to make note of these QIDs. All right. As always, we encourage you to get social with us. We're on rx-coach.com for tutoring, Facebook. We have a blog, firstaidteam.com, for some great information and study tips and a study planner. We're on Twitter, Instagram, and YouTube. But before I hand it off to Jeff, I do want to show you something. It's the same thing I showed you last week, which is RX bricks, which is a part of RX 360 Plus. And this is the brick we went through last time, structure and function of platelets. We have our learning objectives at the beginning and a case connection to help you introduce the topic and relate it to something in real life. What are platelets? We have nice images here, and as we scroll down, we see some flashcards to help us remember things, clinical correlations, mnemonics to help commit those to memory. And as you scroll down through this learning module, which is very conversational, it doesn't seem like you're reading a textbook, okay? It's very natural and free-flowing. It'll tie back to the case connection, then you'll have a summary of your take-home points. Then you'll have some practice questions. And once you get the answer right, you'll see the explanation. And you have your learning objectives, and you can cross them off to see what you're comfortable with. And of course, you can go deeper. You can go directly into first aid. And as you can see, First Aid 2021 has been updated and is available with RX 360 Plus and online now with the digital version. You can go directly into there to read more. You can study with flash facts. You can watch express videos or practice with questions in our question bank. And you know, we've educated a lot of physicians that are currently practicing that have used these resources, especially QMax. Although Bricks is relatively new, it is quite popular. I highly encourage you to take a look. Our students have been raving about it because it helps you stay organized and you don't have to flip through different resources. You can go directly into our resources, learn more, go deeper, and even quiz yourself. So if you haven't already signed up for our free trial, I highly encourage you to do it.